my name is Mariana, and we're going to be learning about the Indian culture today. So, the Indian culture is a complex, diverse, and beautiful culture. India, the country, takes the greatest part of South Asia, and it has roughly one-sixth of the world's population. So, this explains the large diversity of its people, right? The major and main language is Hindi, but English is commonly used. Most Indians are bilingual or multilingual. Culturally competent care is an important aspect in the nursing career, and the way that we communicate with these patients is important, and we should take some considerations. For example, direct eye contact is limited. Traditional greeting is namaste, which is said with the palms together as if in prayer, under the chin, slightly nodding the head and looking down like this. Namaste. If the client does not speak English, we should find a translator to help us with communication. Remember, it is our responsibility. In regards of family structure, for people of this culture, family is the most important institution that has survived throughout the years. The Indian culture relies on family integrity, loyalty, and unity. For that reason, when caring for a client of this culture, we should accept that they might want to have the family present most of the time, and that clients will rely on family to make healthcare decisions. So remember, they might want to have their family with them. It doesn't matter if it's just one, two, or three. If the hospital or the place that we are working in allows for that many people, then we need to bring them in. We need to make them feel that they can have their family with them, okay? It's important for them. For the Indian culture, health is a connection between body, mind, and spirit. Beautiful, huh? Pain and suffering are viewed as a result of bad behavior or karma. Indian people respect the authority of healthcare providers, and they have a lot of respect and good feelings towards us. Indian culture relies on Ayurveda, which means knowledge of life. It relates to the complete human being, body, mind, senses, and soul well-being. For these beliefs, Indian people may tend to wait to seek professional health care when they are ill, and they will use home remedies, massages, or herbal medicine when caring for the ill. They may ask or perform certain rituals on their hospital stay. And some examples are the ritual of chanting by a priest, tying a thread around the neck or wrist, writing a protective verse and wear it around their neck or wrist. And we should understand and try to accommodate care for these rituals. Ayurveda also uses specific lifestyle and nutrient guidelines to prevent illness. Nutrition is very important for this culture. Many Hindus restrict what they eat or drink on religious grounds. Many people of this culture are vegetarians, so they don't eat meat. Certain foods are classified as hot or cold in terms of the effect on the body. Healthcare providers should take in consideration these customs when planning the patient's diets and treatments. So when we do this, we can be culturally competent, right? In regards of religion, 80% of Indian people practice the Hindu religion. Religion greatly influences the patient's view of health, death, and illness. When caring for a person that is dying or providing post-mortem care, We should consider that family may wish to stay near the bedside and involved in care. Patients may have sacred threads around their wrists or necks and tulsi leaves in their forehead or mouth to help the patient die in peace. So we should be aware of that and we should respect that. Um, and so if we find that out in a patient from this culture, we should leave those objects with them. It's part of their culture and their beliefs, and we should respect that. Indian culture is rich and alluring, and even though changes might happen throughout time, Indian culture holds its beautiful roots and traditions, and these play an essential role in healthcare. So, we as nurses should always, always, always practice with compassion and with a culturally competent mindset. Thank you.